22,000 of which were hospitalized, and at least 161 pregnant women have died, with a little more than 20 of those deaths happening in August. Meanwhile, studies show COVID also puts them at risk of pregnancy complications, including stillbirth. But despite all of that, only 31% of pregnant women were fully vaccinated before or during their pregnancy. When you break it down by demographics, the rate is far worse among women of color. Black pregnant women have the lowest vaccination rate at only 16%. And sadly, women of color also have the highest COVID infection rate.
We're bringing in Dr. Teresa Baker, Regional Chair of Obstetrics and Gynecology at Texas Tech Health Sciences Center in Amarillo, Texas. Doctor, thank you for joining us. Now, the CDC isn't just recommending vaccines for expecting mothers, but actually issued an urgent warning to women who are pregnant, hoping to become pregnant, or have already given birth and are breastfeeding. So what's your message to women in these situations who might still be a little hesitant about getting the vaccine?
Our overwhelming message is please consider it. You know, I know there's a lot of unanswered questions, and I know mothers are trying to make the best decision for themselves and their unborn children. But the truth is the vaccine is safer than the virus. And this second big wave of the virus with the Delta variant, we have seen it take a toll on pregnant women in a very negative way. So we're really very muchly so encouraging everybody to consider getting the vaccine.
Now, the CDC is also highlighting some key differences among pregnant women based on race and ethnicity. So why is this so concerning for some populations more so than others?
I do think that we have seen women that are women of color be hit harder by the virus. And obviously resources have a big something to do with that. You know, are they able to get to the vaccine? Are they able to have transportation? Do they have the ability to access the vaccine? And that's our job, is to make that vaccine as available and readily acceptable, and, you know, for everybody that can get it.
Now, I want to go back to an unfortunate but important milestone we talked about earlier in the show. 700,000 deaths since the start of this pandemic. What comes to mind when you consider that number?
Well, unfortunately, the recent thing that comes to mind is how many young people are being affected by the vaccine. You know, we have an ICU full of 20-year-olds and you know, lower 18-year-olds on the vent, and we never expected it to hit that hard in the young, healthy population, but it is, and we need to be talking about that. And those are the women that are at risk of pregnancy, so we need those women to rethink this decision and really reevaluate the situation, because used to we thought it was those that were older or those that had comorbidities, but this new Delta variant is taking a very hard hit on a young population.
Now, Doctor, we're also seeing alarming new statistics that show COVID is killing rural Americans at twice the rate as those in larger cities. Now, I understand you're in Amarillo, Texas, so what's happening in communities like yours that's causing these differences?
So if you can believe this, we're the referral center. So, you know, there are small communities an hour, 2 hours outside of here that don't have the access to the vaccine, first of all. They don't have the capability of ICU beds. And then when they do need a higher level of care, they need to transfer the patient for a ventilator or additional services. There's no bed to transfer them to. So we're full. We're on diversion. You know, they have to go to the next larger city and on down the road. So there's no doubt in my mind that those people that are in outlying communities or rural communities are at real disadvantage simply because they cannot get to the care that they need, especially as they get sicker.
Now, I want to zoom out a little bit and talk about vaccine hesitancy in general, because certainly access to health care when it's needed is one factor, but there's also an access to vaccines that's not being taken advantage of. You know, we have large companies that are mandating them now. We have more opportunities for boosters and possibly kids as young as 5 years old that could soon have access to them as well. But how concerning is all of that? Given the fact that there are still people out there who are eligible now and have been for months who still refuse to get it. They're even risking their jobs over it.
Right. I talk to women all day long, and that's the group I can speak to. And what I hear from them is fear and the unknown. And, I can understand that as a pregnant woman, trying to make the best decision she can for her unborn child without all the answers and wondering what the future is going to tell us about the vaccine. And all I can say is we need to be telling them the truth. We need to, we need to just be informing them of what we do know. We need to continue to encourage companies to include pregnant and breastfeeding women in those trials so that we've got actual data to share with them. And then we need to meet them where they are and just continue to have the conversation. I don't know of a mother that's not trying to make the best decision for her child, but she, you can hear the fear in them, and they want answers that sometimes we don't have. So I just encourage everybody to just meet them where they are and continue to encourage and continue to push the point that the vaccine is less dangerous than getting the virus itself.
All right, Dr. Teresa Baker, thank you so much for your insight and for joining us here on NBCLX.
You're welcome.
At NBCLX, we see you.
Soy extraordinaria.
Changemaker.
Trailblazer.